about what that kid's foot is going to end up like. So we need to give the respect that is due an expert, because our families are the expert in the children that they're raising. Communication in healthcare is absolutely key. Trust and respect are vital. We need to make sure that information is readily available. You may have experience, even in your own life, if you receive a shocking diagnosis or something that is overwhelming. In fact, the first visit, you may take in only 1 or 2 points of a 10-minute briefing that you were given. So that means the next time you come, actually, you should probably get much of the same information again, because once the shock is worn off, you have more questions and more things. So we need to be patient around giving information at the time and in the way that is most acceptable to that family. And finally, reducing economic disincentives. Coming to care is expensive. It means missing a day of work. It means taking time away from other childcare tasks or household tasks. And so we've got to try and figure out, if those things are barriers, how do we reduce those disincentives for our families? Really, dropouts are an issue that must be tackled in partnership between Miracle Feed partners, so the programs people, and clinics and clinicians. The two groups need to be on the same page in your commitment to patients and have lots of clear discussions around the specific dynamics at each clinic which are affecting patient retention. This is not something that a partner can fix on its own, and sometimes it's not something that a clinic can fix on its own. This is a really important thing that must be done in partnership. Okay, dropout strategies. The first thing I'm tackling is service to patients. Poor service in the clinic can really affect a patient's experience. If you're looking at casting dropouts that are high, then I would bet that poor service is one of the things. Poor service or poor communication. If there are very long waiting times and overcrowding, one of the things you can do is to expand to more clubfoot clinic days. So if the clubfoot clinic's on a Tuesday, maybe you can convince the hospital to also do it on a Friday. Or you can look at it a different way and train more clinicians to be able to work through the waiting room in a more timely way. You should look at things like waiting areas, simple things. Is there enough seats for everybody? Is there shade? Is it extremely hot or extremely cold? And is there a way to make use of waiting time? So things like having somebody leading a discussion in the waiting room. Hey, what are some tips you have for brace use? Or what do you say when somebody tells you that you should take the brace off the child? Or any number of discussion topics that can start people in the waiting room speaking to one another and helping to build up and encourage one another. You can also put things like a TV in the waiting room so that something is playing to distract people from the waiting, and things like activities for the children, having some small things that the kids can be doing while they're waiting. If providers are rude or intimidating or dismissive or uncommitted, if parents feel disrespectful, or the flip side, like to feel fearful to come back if they've done something wrong. These are all problems, and it affects our dropout rates. So make sure that respect is communicated and emphasised really strongly in trainings, using that family-centred approach where the family is the expert on the child. And if we continue to work with clinicians who are rude and dismissive and uncommitted, then I would encourage you to consider whether that clinic partnership is the right one for us, because parents who come to our clinics deserve to be shown respect and encouragement. You will not find that a clinician will say, oh yes, actually I'm very rude to my patients. Nobody says that. Supportive supervision is one way to kind of get a sense for what's going on at the clinic level, whether things like overcrowding is an issue, whether the manner and the tone of communication is a problem. So supportive supervision is really important, and that's the kind of thing that supportive supervisors should be noticing if they're seeing things that are red flags for them. Okay. Parent education. We need to provide families with a full overview of treatment process at the first appointment, supporting them with visual resources, things like flip charts, brochures, posters. Some people really struggle with reading, but visuals make a lot of sense to them. In Bangladesh, I saw that you do this really beautifully with flip charts for patients, and I saw that not only did you have the resources, the clinicians that I were able to observe took time to go through them with the parents, giving them the chance to ask questions, to express their concerns. I found that to be really, really encouraging. In some parts of the world, they have volunteer parent counsellors. So that might be a parent who has gone through the whole treatment process and wants to come back and encourage others. Those roles are often supported with a small stipend or transport, something like that. But those people move around the waiting room and make sure that families feel welcome and informed. I would encourage you, if Club for Treatment is not happening on a specific clinic day and is sort of wrapped up in general outpatient visits, this makes it hard for peer support to come together. I know it's not always our decision, but where you can have specific clinic days, it allows the mums to speak to one another in the waiting room. And then if we continue to facilitate and encourage these discussions, that value adds. We can even connect one mother to another. So, for example, mother who's in the bracing phase, we can say, hey, I'd like you to meet Mariam. Her baby has just started casting. Could you tell her what that experience was like for you? Or somebody's moving into bracing and you introduce them to Mohammed, whose child is now finishing bracing because they've done it really successfully. And if those two are able to talk outside of the clinic even, that becomes a real strength and encouragement for those families. Giving materials to take home can be especially useful where family decision makers are not in the clinic with you. If you convince mum but mum can't convince dad or grandma, then that obviously is a reason why families drop out of treatment. This can be something where you give them a brochure to take home, or you say, hey, could we get your husband on the phone, and I just would like to talk through treatment to him at home as well. That's one way to manage that. And then where social media is widely used, you can use social media to build a community of parents who support and encourage